everyone, this is Suprava. Welcome back to another session with me. In today's session, we will discuss about a topic in which we will learn how to manage a low birth weight baby. Well, before learning the management of low birth weight baby, we should understand or when do we consider determine a baby is low birth weight. Basically, if we see the meaning of low birth weight baby, it is a neonate with a birth weight of less than 2500 gram is called as low birth weight baby. Also, you have to remember that this weight or this birth weight is irrespective of their gestational age. That means it doesn't concern that, what is the gestational age of the baby, whether the baby is preterm. We have to see the birth weight and it should be 2500 gram. When it is less than 2500 gram, the neonate is termed as low birth weight baby. As I told you that it is irrespective of gestational age, so that means it includes preterm babies and also the small for dates babies and intrauterine growth retardation. As I told you that it is irrespective of their gestational age, that means it includes the preterm babies and also the small for dates and IUGR babies. Why we are studying about the management of low birth weight babies? Why it is more important? Because these low birth weight babies are more prone to infection and they are also more prone to malnutrition and some sort of neurodevelopmental handicapped conditions. So basically, we can say that they are more vulnerable towards certain risks, and that's the reason, we have to take certain extra care related to these babies. So that's the reason. So today we will see how to manage these babies. I hope you understood that, what we mean by low birth weight babies. So basically, when their birth weight is less than 2500 gram, irrespective of their gestational age, they are termed as low birth weight babies. We said that if the birth weight is less than 2500 gram, they are termed as low birth weight baby. It also has classifications or certain terminologies are there under these low birth weight babies. So first let us understand that, what are the terminologies and how to classify these low birth weight. So the first thing that comes, so when the birth weight is less than 1500 gram, we call it as very low birth weight babies. And when their birth weight is less than 1000 gram, we call it as extremely low birth weight. So here we got two terms, that is very low birth weight and extremely low birth weight. When the birth weight is less than 1500 gram, we call it as very low birth weight. And when it is less than 1000 gram, we call it as extremely low birth weight. We also have one more classification, that is small for dates, or we can say a terminology that we use, small for dates babies. With this term itself, you can understand that small for dates means they are small related to, if we compare with the date. Here comes their gestational age. Babies with a birth weight of less than 10th percentile of their gestational age is termed as small for dates babies. And they are also termed as small for gestational age or IUGR babies. Now this was small for dates. So we also have one more terminology, that is appropriate for dates. When their birth weight is between 10th to 90 percentile of their gestational age, we call them as appropriate for dates babies. And they are also termed as appropriate for gestational age. Now we said that if it is between 10th to 90th percentile of their gestational age, they are appropriate for dates. Now what if it is more than 90 percentile? So when these babies with a birth weight of more than 90th percentile of their gestational age, they are termed as large for dates. And they are also termed as large for gestational age. So we understood very low birth weight and then extremely low birth weight. Then we learned about small for dates, appropriate for dates, large for dates. Next we have preterm baby. You might be very familiar with this particular term that we often hear, that is a preterm baby. So when a baby is born with gestational age of less than 37 weeks, we call them as preterm baby. And these babies are also often called as premature, born early or immature. We know that if the baby is born before 37 weeks, before completed 37 weeks, we call them as preterm baby. And next thing is term baby. I think you can guess when we will call them as term baby. So it should be beyond 37 weeks. So when a baby is born between 37 weeks to 41 weeks, we call them as term baby. And then we have one more term, that is post-term baby. So when a baby is born with a gestational age of 42 weeks or more, we call them as post-term baby. We understood that what are the different terminologies that comes under low birth weight babies and when we consider a baby as low birth weight. Now, it is very important to prevent or reduce the incidence of these low birth weight babies so that we can bring down the cases of perinatal mortality rates and infant mortality rates. We have already studied about the child mortality and morbidity rates, where we have learned that one of the major reasons of these cases are low birth weight, right? Because they are more prone to malnutrition, infection, and they are basically more vulnerable towards these things. It is very important to reduce the incidence of low birth weight babies. And to do that, we have to eliminate the causes of this small for dates babies or the low birth weight babies. So that's the reason we have to learn about the causes of low birth weight babies. So let us see that what actually causes happen this low birth weight babies. Now basically here we have divided the causes into two parts, that is spontaneous causes and then induced causes. So first let us understand that what are these spontaneous causes that might cause a low birth weight baby. Now what are the induced causes? So there might be certain conditions where we need to induce a preterm labor to safeguard the fetus or to safeguard the mother. When we get to know that there is an impending danger for them if we don't induce the labor, but if you don't take the fetus out, that might be dangerous to the mother or to the fetus. That time we induce preterm labor. So what are these causes? If the mother is having diabetes mellitus or any kind of severe heart conditions, in that case might have to induce preterm labor. In case of placental dysfunction, so if the placenta is not functioning properly, if there is dysfunction of placenta, then there will be unsatisfactory fetal growth. So in that case also we might have to induce preterm labor, and that is again a cause of preterm birth. And if there is fetal hypoxia, if the fetus is not getting enough oxygen and there is fetal distress, then we have to induce labor, preterm labor, and that will lead to a preterm birth. The next thing is in case of severe Rh isoimmunization, it deliver the care based on their needs. First and foremost thing that we can see is that they will be small in size with relatively large head. At birth, their head will be larger than their chest basically, and then as they will growth and development, the measurement would change. Here in the preterm baby, what we see is the first thing is that they will be small in size and with a relatively larger head. If we see the head circumference of the baby, it would be less than 33 centimeter because the baby is preterm. And if we see the head circumference of the baby, it would be less than 33 centimeter as the baby is preterm, but it would be 3 centimeter more than the chest circumference. The general activity of the baby would be poor. Reflexes such as motor reflex, sucking reflex and swallowing reflex, these reflexes will be incomplete. Also, there will be hypotonia. And regarding the head, that we have already said that the head would be larger than the body, and the skull bones, that the bones would be softer, and we can see the sutures would be widely separated. Sutures won't be joined, and the fontanelles would be large. Also, we can see that there would be less buccal fat. Regarding the eyes remain closed and that will be protruding due to the shallow orbit. And the ears are soft, flat, and the cartilages are not fully developed. Coming to the skin is thin and there would be a little presence of vernix caseosa and there will be plenty lanugo hair. Also, the subcutaneous fat would be less in a preterm baby and sometimes we might see that there might be presence of edema. Coming to breast, the breast nodules would be absent or it might be less than 5 millimeter and the nipples and the areola that would be flat. The next thing is abdomen. So in abdomen, it would be full and it would be soft and we can see some prominent veins. The next thing is about genitalia. So in male baby, there would be undescended testis and the scrotum would be poorly pigmented. And in case of female baby, the labia minora would be exposed due to poorly developed and widely separated labia majora. And we can also see the clitoris would be hypertrophied and it would be more prominent. So these are the characteristics of preterm infants that we can see. The next thing is what are the problems that they might go through. Now in general we said that when we started this topic we said that these babies, these low birth weight babies are more prone to infections, they are more prone to malnutrition, they are vulnerable to some sort of risks. Now what are these particular risks? So that we are going to see next, that what are the physiological problems that preterm baby might go through. So the first thing that we are going to discuss, the first physiological problem is alteration of respiratory functions. So the respiration of preterm neonates are rapid and it is shallow and we can see that there would be episodes of apnea and cyanosis. And the cough and gag reflexes are weak or absent in these babies. As we also discussed about the reflexes, that motor reflex, sucking reflex, swallowing reflex would be incomplete. Same way, here also in the respiratory functions, the cough reflexes or the gag reflexes, it might be incomplete, it might be weak or it can be also absent. So basically their respiratory muscles are weak. And if you see their lungs also, that is, there would be poor development and poor expansion of lungs. So basically there is inefficient respiratory center and there is also deficient surfactant in the alveoli. These things are responsible for respiratory problems and this is one of the reasons due to what, there is need of resuscitation at birth. The next thing is about central nervous system. So there would be also immaturity of central nervous system. So basically as we said that these preterm babies would be inactive, they would be lethargic and they have poor cough reflexes and also their sucking and swallowing reflexes are incoordinated. That's the reason the feeding these babies would be difficult. That becomes difficult because their sucking and swallowing reflexes are not coordinated. Now these babies are more prone to kernicterus or brain damage as they have inefficient blood-brain barrier. The next thing is about circulatory function. So there would be some sort of disturbances in their circulatory functions also. In preterm neonates, the first thing that we can say is that closure of ductus arteriosus might be delayed. And their peripheral circulation would also be inadequate. Apart from this, there is also poor autoregulation of cerebral blood flow. Also, if we see their digestive system, protein and the carbohydrate are properly digested but fat is poorly absorbed. The next thing is that the maturity of the liver is also not completed. This immaturity of liver and its poor enzymatic actions leads to hyperbilirubinemia. Now we know these babies have delayed feeding, they have birth asphyxia or respiratory distress syndrome and also they have poor hepatic glycogen stores. All these things might lead to hypoglycemia. Now going back to the introduction where I said that these low birth weight babies are more prone to get infection, they are more prone to get malnutrition. I think by now you understood that why these babies are more prone to get malnutrition, because these things are related. Their sucking and swallowing reflex are poorly developed and that things leads to poor intake of food. That's why these babies are more prone to get malnutrition. They are also more prone to iron deficiency anemia and deficiency of vitamins A, D, E and K. And these things are because of poor absorption of nutrients. The next thing is metabolic disturbances. So due to the poor metabolic functions, these preterm neonates are more prone to get hypoglycemia, hypocalcemia, and hypoxia, hypoproteinemia. The next thing is that increased susceptibility to infection. We are already told many times that they are more prone to infections. So these preterm neonates are 3 to 10 times more vulnerable to infections than normal neonates. Basically, they have inefficient cellular immunity, and also they have low IgG antibody. These things make them more susceptible to infections. Apart from these things, these preterm neonates are excessively handled by the healthcare team, by the family members, because of several procedures, and also there might be need of resuscitation or some sort of invasive procedures that again increase the risk of infection. So that's the reason these preterm neonates are more susceptible to infections. So this was about increased susceptibility to infection. Now next we are going to see impaired renal functions. Now the first thing is that these preterm neonates are more prone to develop acidosis. Why? Because their glomerular filtration rate is low, and also the concentrating ability of the renal tubules are less. So as there is an inability to conserve water, they might have dehydration. So as they will have solute retention and low serum proteins, they might develop edema. And if these things are not treated, then that might lead to renal failure. And we have already learned that, there is poor hepatic functions and there is reduced renal functions also. Now, this poor hepatic detoxification and reduced renal clearance, because of these two things, there might be toxic effects of drugs if the precautions are not being taken during the administration of the drug. Drug toxicity also might happen in these preterm babies. So that is why while administering these drugs, we have to follow the precautions. These were about the physiological problems of low birth weight babies. Now we know that what are their characteristics and what are the physiological problems that they have or they might develop. So now it's quite easier for us to handle these kind of babies, right? So now next we would learn the management of low birth weight babies. So in the management, the first thing we said already that prevention is very important. Preventing or reducing the incidence of these low birth weight babies. There should be early detection of preterm labor. If there is, now we have learned what are the spontaneous causes, what are the induced causes. So it is our responsibility to check that if there is anything like that, any sort of causes are present in the mother or in the fetus, we have to refer the mother to a well-equipped facility, and also we have to take all the preventive measures to prevent the preterm birth. First, we would learn that care of these babies at birth. So at birth, what are the when there is a low birth weight baby, what are the things that we should take care of and how we should handle the baby, what are the management that we should do. Now we have already learned that they have altered respiratory functions. It's very important to establish the breathing. If there is no spontaneous breathing, in that case we have to do resuscitation. There should be efficient resuscitation at birth. And also one more thing which is a very important aspect of care of preterm babies at birth is that preventing hypothermia. They are more prone to develop hypothermia due to certain factors that we have already learned, right? So these two things, that is the efficient resuscitation and also prevention of hypothermia, are the two major aspects of care of low birth weight babies at birth. Now there is also one more thing that in these babies sometimes there would be delayed cord clamping, and that is because that would help with iron storage. But then again, you have to do it according to the baby's condition. Basically, we have to focus on providing continuous breathing support, and warmth should be maintained. If the baby is less than 1000 gram, in that case, we are going to administer 0.5 mg of vitamin K. And if the baby is more than 1000 gram, in that case, we are going to administer 1 mg of vitamin K. Once we stabilize the neonate, once we stabilize with the temperature, the breathing, and we provide vitamin K, So once the baby is stable, we have to transfer the baby to neonatal intensive care unit. Next step is care of these babies at NICU. So once we do the care at birth, and after that we're going to transfer, once the baby is stable, we're going to transfer the baby to NICU. And at NICU, what care we should provide. So the first thing that you need to understand about care at NICU is that the care should be as like as the intrauterine environment. So it should be warm, it should be free from excessive noise, and it should have a soothing light. At this time, we have to ensure that they are more susceptible to infection. So whatever procedures that we are doing, we have to make sure that we follow aseptic technique and we safeguard the neonate from infection. Also, they should not be rough handling, and they should not be painful procedures. So whatever painful procedures are there, that we should avoid at this period of time, because that might cause trauma to the neonate. So basically in NICU, there should be continuous monitoring of the clinical status of the neonates. And one more thing is, whenever we do any procedures in the NICU, whenever we're handling a neonate, we can place the neonate in a prone position, because in that prone position, the neonates are more comfortable, they cry less, and also there is reduced chance of aspiration. So why it is comfortable for them and they cry less? Because this position relieves abdominal discomfort and it improves the ventilation and arterial oxygenation. But we have to make sure that whoever is placing the neonate in prone position, they should be well trained. If it is not supervised, and if the person is not well trained, in that case, if it is not proper, it might cause sudden infant death syndrome. These are the two things that we saw in general, that what care we should provide at birth and then at the NICU. But now we are going to see that what are the particular or specific aspects where we need to concentrate for these preterm babies. So the first thing is maintenance of breathing. So there are some major aspects where we need to concentrate more, we need to focus more. So the first thing is maintenance of breathing, and we have already learned that respiratory distress syndrome is very common in these babies. So that's the reason we have to position the baby in position where the neck is slightly extended, and if there is any kind of secretions are there, that we have to remove with suction. So that's why we have to position the baby in such a position where the neck is slightly extended, and if there is any secretions present, that we have to remove by gentle suctioning. And also, whenever you are feeding the baby, you have to take the precautions that these feeding the food or the secretions or whatever is present, that should not cause aspiration. And you have to provide oxygen therapy whenever it is indicated. Basically, to maintain breathing, we have to continuously monitor their respiratory rate, the rhythm, if there is any kind of signs of distress, chest retraction, or if there is nasal flaring, if there is episodes of apnea or cyanosis. And then we have to see we have to monitor their oxygen saturations also. So these things should be monitored at frequent interval. Also, to stimulate the respiratory effort, you can provide tactile stimulation on the sole. Also, to stimulate the respiratory effort, you can provide tactile stimulation by sole flicking. So these things can be done too in maintenance of breathing. So apart from breathing, we told that one more major aspects of, we can say, concern in these babies. That's temperature. Next, we will see maintenance of stable body temperature. So the baby should be received in a pre-warmed radiant warmer or incubator. And we have to maintain the environmental temperature based on the baby's weight and age. And we have to maintain their skin temperature. Okay, so the normal skin temperature should be maintained. So once these babies are a little bit they are stable, we can provide kangaroo mother care, and all measures should be taken to prevent heat loss. So bathing can be avoided in these babies, and we can use external heat sources whenever we need to, protect the temperature of the neonate. Apart from these, there should not be unnecessary exposure of the body parts. So you have to make sure that the neonate is well covered, and the feet and the hands should be well covered. So there should not be heat loss, unnecessary heat loss from the body. And that is how we have to maintain the stable body temperature for the preterm neonates. The next thing is about maintenance of nutrition and hydration. So during the first week of their life, their calorie requirements is around 60 calorie per kg per day. And as grow older, during the second week and the third week, their calorie requirements increases. So we have to make sure that we provide proper nutrients and we meet the requirements of the neonates. The neonates who are having, less than 1500 gram weight, for them the fluid requirement is 60 ml per kg per day, and then we have to increase that 15 ml per day. We have to make sure that we are well aware about these requirements, that what is the nutritional requirements and the hydration requirements, and based on that we meet the requirements of the neonates. This was about the management of low birth weight babies. Now we would see the health education, that what are the nurses' role in health education. So when you are providing health education to the parents, what all things you should tell the parents. So this was all about the management of low birth weight babies. Now the next thing that we are going to see is the health education. So when you are providing health education to the parents, so what are the things that you should tell the parents and you should keep in mind? So the first thing is that prevention of infection, which is very important, and the family members and the parents should be educated on this. So this was about the management of low birth weight babies. The next thing that we are going to learn is health education, or the nurse's role in health education. So when as a nurse you are providing health education to the parents or to the family members, what are the things that you should tell or you should keep in mind? So the first aspect that we are going to cover is that prevention of infection. Now we know that preterm babies are more prone to, get infections, and it's very important to prevent infections, prevent nosocomial infections or any sort of infections in them. It is a very major aspect and on which, the parents or the family members should be educated. So we have to instruct the family members and we have to instruct the parents that whenever they are handling the baby, they are involved in any of the procedures. As we focus on family-centered care nowadays, we involve the parents also, involve the family members also, right? So they should be aware that they should do thorough hand washing before doing any kind of procedures, before doing, before getting involved in any kind of procedures, or before handling the baby. Also, you have to instruct them that the clothes they are wearing or the gowns, if they use, that should be sterile, and the mask or whatever protective measures that they are using, that should be sterile. You also have to educate them that there should be restriction in visitors. When the neonate is in hospital, at that time also there should not be frequent visitors coming in, and if the neonate is discharged, even after that also, when they should be limited, there should be restriction in visitors. And also you have to educate them about that if there is any infected person in the family, then they should not be allowed inside the neonatal unit. And even if the child is in home, at that time also this infected person should not be in contact with the neonate. The next thing that we would discuss about the discharge planning, follow-up and home care. When you are discharging the neonate, the condition of the neonate should be explained to the parents, and the progress, how the condition is progressed, that also you need to explain to the parents to reduce their anxiety. Also, you have to discuss that what is the treatment plan and how to take care of the baby at home. What are the need for baby, that is the warmth and exclusive breastfeeding. What is importance of environmental hygiene, and what is importance of follow-up care, immunization. So these things should be explained to the parents and the family members. So today we learned about when we call them as low birth weight babies. So basically, if their birth weight is less than 2500 gram, irrespective of their gestational age, we consider them as low birth weight babies. And then we learned about certain terminologies or the classifications, we can say, that is very low birth weight, extremely low birth weight. Then we learned small for dates, appropriate for dates, large for dates. So these are some of the terminologies that we learned. And then we learned about preterm baby, term baby, post-term baby. So these were some of the terminologies. And then we learned that what are the characteristics of these preterm infants, how their skin will be, how their head will be, what about the sutures and the fontanelles. After learning the characteristics, we learned about the physiological problems that a preterm baby might go through, and also what are the physiological problems that might occur, so that we can prevent that and we can take care of the low birth weight babies in more effective way. And at last, we learned about the management. As a nurse, what are the interventions that we should take, and what is our role in health education. So I hope you have got better insight about the topic and you have understood it well. Thank you.